Welcome back, everyone. Menopause Energized 30-day Healthy Heart Marathon. We are on day number 6. For some reason today I'm having these palpitations. Where are they coming from? I don't understand it. My heart is doing this and trying to figure out why I'm having these palpitations. What did I eat today? What did I do? I don't usually have these palpitations. I guess I need to try to find out what's going on. Hey, you guys, this is Sheila. Welcome back to my channel, Menopause Energized, and we are doing this 30-day Healthy Heart Marathon. So today is day 6, and today we're going to be talking about palpitations. Day 5, we talked about congestive heart failure, some of the symptoms we need to watch out for that. But today we're specifically going to be talking about palpitations. Have you ever felt your heart just racing or skipping a beat during your menopausal years? You are not alone, and it could be related to menopause. So stick around. I am going to reveal the real reasons why your heart races during menopause and what you can do to protect your heart. And today we're talking about palpitations in the menopausal years. This could be for anybody, but specifically my program is on women's health in the menopausal years. So exactly what are palpitations? That's when the conduction system in your heart starts to working a little irregular, and it's due to certain stressors. And who can we blame it on again? Remember, I say this all the time. We blame it on the hormones. Yes, that estrogen level, when it takes a dive, your heart becomes more sensitive to triggers now. It can start as early as 30s, but menopausal years start somewhere between the 40s on up. But some people do have palpitations in their 30s. I was actually one of them, taking care of a patient one day, walking down the hall, and start feeling these little palpitations hitting up against my chest. Had no clue what's going on. I said to myself, oh my gosh. And I was a nurse, but still, it was scary to feel it for the first time. I wanted to know what was going on with me. And I realized that was the beginning of my palpitations. And then there were certain things after that I could not, I had to avoid. So palpitations, again, estrogen, it does something where it makes it more sensitive to your heart with the conduction system in your heart. Because remember, we talked about it early in day 2, I believe. Estrogen protects the heart. It has a lot to do with protecting the heart. And so some of the triggers are biggie. Number 1, people will tell you this: stress. Stress can bring on palpitations. It don't usually make your heart rate low. It usually make you either feel an irregular beat when you're stressed out, for some, not everybody, or it takes your heart rate up. Remember now, palpitation, we're going to clarify this myth. Some people think palpitations is that a fast heart rate. Your heart rate do not have to be fast to have palpitations. You can have like a skip beat. Your heart is normal, but it's a little skip beat, and you feel it up against your chest. So it don't necessarily have to mean that your heart rate is high for you to call it palpitations. In the medical world, we call them arrhythmias. Most of the time, this is the answer. Most of the time, palpitations are benign. Most of the time. Caffeine will do it. When I was younger, I could drink caffeine. I really wasn't a caffeine drinker, but everybody was drinking it on the job, and we worked night shift. So I felt like since they so alive and hyper, let me start with the caffeine, and I did. And it did help a little bit to keep me awake during the night shift. But then after a while, the caffeine started bothering me. I started getting palpitations, so I had to cut the caffeine out. Exercise. You can have some palpitations during exercise routine, but if it's persistent, you really need to be careful with that and get that checked out. But it's not unusual to have a few palpitations during when you exercise. We don't have time to go in it now, but of course, when you exercise, you are going to raise your heart rate. There is information out there to tell you what your heart rate should be like 5 to 10 minutes after your exercise. Because if your heart rate is still 160, 170, 2 hours later, after you finish your exercise, that's a problem. Energy drinks are the worst. I can't tell anybody on here to avoid anything. Energy drinks is loaded with caffeine. If you notice, it's in the news sometimes where people have really not good outcome for drinking these energy drinks. I don't know if they're consuming too much of it, but energy drinks is the worst, especially for women in their menopausal years. And then your doctor, when you go in, this is the reason why they check your electrolytes, because magnesium, calcium, potassium helps to regulate your heart rate. And so foods rich in magnesium, calcium, and potassium will help that. And then, as you notice, I'm going down all these here. We'll talk about how you can relieve these or help these palpitations with the stress, of course. Hard to do with the world we're living in today, but you would try to find different mechanisms to control your stress level. Cut down on the caffeine. Do your regular exercise routine. Don't take that away. I would say if you can avoid the energy drinks, it's up to you. I would avoid them altogether. Make sure your doctor is checking your electrolytes. Alcohol is another one because it dehydrates you. And so when you're dehydrated, your heart rate goes up. You don't know how many times we get patients, or we were getting patients into the emergency room where their heart rate was 140, 150. And guess what? There was no serious medical problem with them. They were just dehydrated. What was due from being sick, throwing up, all the alcohol, they would have a high heart rate. So you got to be careful with that. Don't get in the sauna and then have your alcohol too. Some people are going to do fine. Everybody is not that lucky. So dehydration can cause increased heart rate. Hot flashes, absolutely, absolutely. You can have palpitations or increased heart rate before the hot flash. Some have it after the hot flash. So of course, we talked earlier, I forgot what day that was, that we talked about the hot flashes. I don't know if it was day 4, day 3 or day 4, but we already talked about how to relieve some of the hot flashes. Thyroid is important. There's in your thyroid certain things that there in your thyroid that regulates your heart rate. We won't go into that either. That's another long story. That's why the doctors check your thyroid levels every year. Poor sleep can cause a lot of problems. Poor sleep can also affect, not alone, but poor sleep can affect how you overall feel, which can eventually, if you're not getting the sleep and you're worn out, then you can have problems with your heart rate as well. You might feel like a palpitation. I'm not saying you necessarily will feel like your heart rate going up, but you may feel a little palpitation. We all will get palpitations in our lifetime, no matter what. It may not have nothing to do with menopause at all, because our conduction system in our heart is not perfect. So every now and then you may feel a boop, boop, and it's called a PVC. We won't go into that, but that's something that we all can get here and there. So even not in the menopausal years, it is in life, you can experience a couple of palpitations here and there that is benign. But if it's persistent all the time, you should get that checked out. And then hidden stimulants also. Sometimes you're taking in stuff that you don't know. I don't know why I didn't think of this one time, because I started having palpitations with the caffeine. I think too, when I really noticed it, when I was taking care of a patient on the floor that was having continuous seizures back to back to back to back, and the doctor told me to stop running down the hall every 10 minutes because it was psychogenic. They weren't real. Well, I've learned in my nursing years from different situations I've been in, that patient is on my watch. She's on my license. So whenever she has one, yes, I'm going to check on her. But what happened was I was trying to keep the caffeine in me to keep myself awake to make sure I was keeping an eye on her. And I wound up having full-blown palpitations. Tachycardia is what we call it. It's just a high heart rate. It's regular, but it's tachycardia. And then I kind of realized then that, oh, it must have been the caffeine. I probably had about 4 cups that night. There is something, and I'll say it now before I forget, where, no, I'll wait until the end to go into that. But let's see here. And, we talked about the hidden stimulants, chocolate. Chocolate for some people cannot handle chocolate. For me, that was another one I found that I could not take in my perimenopause and menopausal years was chocolate. It did give me palpitations and increase my heart rate. So I had to stay away from chocolates for years. One of my favorite foods. I'm now just taking a little bit here and there and just a small amount, because it seemed like my biggest problems was when my estrogen took the deepest dive, which is going from your perimenopause into your menopausal years. So now I am postmenopausal. I still have some symptoms here and there, 90% better, but it seemed like since my estrogen has balanced itself out, I'm not, my body doesn't respond the way it used to some of those triggers. And then anemia carries oxygen-rich blood, and when you have oxygen-rich blood in your body, and when you go low, your blood count is low, anemic, yes, you can have palpitations, and you can also have an increased heart rate as well. And then we just talked about the dehydration. When you take your pulse, most of us know how to take our pulse. You just take your two little fingers, put it on your wrist, find your pulse rate, and if it's going duh, 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 you count it each beat. 1, 2, 3, 4. Count it for 30 seconds if you don't want to wait till 60, and multiply it by 2, and that will be your heart rate. If you want to wait the full 60 seconds, just count it up to the 60 seconds, and you'll get your heart rate. American Heart Association, heart rate between 60 and 100. If you can know your average pulse rate, it is really good to know, because everybody don't fit into the range of 60 to 100. For me, my heart rate has always ran low in the 50s. So if I get up to 90, I feel it. I just feel a difference. So you really have to know the average rate of your heart rate, because 100 for some is too high. But they're saying 60 to 100 is a normal heart rate. For athletes, their heart rate will sometimes be in the 40s, and that's okay, because that's what their body is used to, so that's usually not a problem. Also, your heart rate will drop low while you sleep. For some people, heart rate can drop as low as 40s while you sleep. You most likely will not feel it at all unless some people let those Fitbit watches control them, where they wear it at night, and then they wake up in the middle of the night because they find out that the Fitbit watch is telling them that their heart rate is 46. But your heart rate do drop low in the sleep, and for some, especially for people that have like sleep apnea and things like that, heart rate can be low during the night. The best way to do this is to keep a journal. Find out what your triggers are. What is your pattern? If you start getting palpitations and they come out of nowhere, we keep a journal. We're going to be doing this when our 8-week coaching program comes out soon on Zoom Live, where all the women get together and I do the coaching. And of course, you ask questions and we all learn from each other. Can you imagine how wonderful that would be? Where not only me just coaching, we're all going to learn from each other, because there may be some other problems that women had that helped for them. Just to remind you, it's definitely not for you to get on there and tell any of your personal health information. We're just going to be talking about menopause and how it affects us. And I will be sending out soon an assessment for you all to take. I want you guys to fill out that assessment if you can. You don't have to leave your email or anything, but I want to know what you want in the program as well. I can always modify and add in. It's not just about what I think you would want. A lot of it is too, because I know I've been there and I've done months and months of, or years really, of evidence-based research to know what worked. That's how I survived this whole thing. And that's in another video I'll tell you about it, the challenges I had. And I will be sending out assessment to let me know what you would also like to see in the program. But keeping the journal is really important. We're going to be doing that journal for the whole 8 weeks. It's just good to have in your menopause journey, but start tracking your triggers, then you know what to avoid or what to cut down. So to recap, most of the time, palpitations are benign, nothing to worry about, but when it first happened, it's scary. It's very scary. But the warning signs, this is what I want you to know. We said that most of the time it's benign. There will sometimes come a time where they may be dangerous. And so what you need to watch out for, if the palpitations are persistent, you need to get that checked out by the doctor. Some doctors will put on a Holter monitor. Years ago when I had to wear them because I had so many palpitations, they'd be these big old suitcases that I had to carry on my waist, and everybody knew, and I kind of knew my business. Oh, Sheila, what are you wearing? What's going on with you? But now they're making these Holter monitors like that small, literally that small, and it gets placed right on your chest, and the leads get placed here. Nobody would never know you have them. So sometimes if you're having frequent palpitations, your doctor will order a Holter monitor. If you're having palpitations and you're having chest pain with it, you should seek medical attention. If you're having palpitations and you're having dizziness with it, you should seek medical attention. If you're having palpitations and having shortness of breath, you should seek medical attention. Ladies, this is no joke. I'm going to keep going back to this. What did I say day one? Cardiovascular disease is the #1 killer in women. Yes, you need to pay attention to these. Did we just say shortness of breath? I believe we did. Syncope, for you guys that don't know, it just means that you passed out. If you have palpitations and you passed out, you could have a serious arrhythmia, we call it, basically an irregular pulse that is going on. That even though if you went and got up and said, I'm not going to the doctor, I'm going to lay down, and you lay down and you get up and you feel okay, that's not okay, because you don't know if that's going to happen again. And if it happens again, we're not sure what may happen. So you need to get that checked out early, because there are people that will pass out. Some people just pass out, they're not sure why, and they'll go in bed. I mean, they do that. But when you're having palpitations, syncope, and you pass out, you need to get that checked right away. You do not have to have all these symptoms together. If you have palpitations and just one of these symptoms, you need to get it checked out. You don't have to have all these together. If you just have one of these symptoms with the palpitations, you need to get it checked out. The other thing I want to discuss that I said I was going to save for last is the numbness in extremities or weakness with your palpitations. Mainly with your palpitations with a high heart rate. Because when I say palpitations, your palpitations with this can be a high heart rate or just irregular, normal but irregular, either one. But you really want to watch out for the heart rate that increases. And like I told you before, it's called tachycardia. But there is one, arrhythmia, that can be dangerous, and it's called atrial fibrillation. That is when your heart beats fast. It still beats fast, but this time it's a regular fast. That's dangerous, and that's where you may get the numbness in extremities and the weakness or some slurred speech. The reason why, that atrial fibrillation can break off little clots, and if it travels to the brain, you get what you call those transient ischemic attacks, TIAs. So you want to be careful with that. So that's all I wanted to explain today, what palpitations really are, what they come from, what you can do to try to cut down on those palpitations. It worked for me. Like I said, today I'll have a beat here and there, but not much. I probably wound up in the emergency room a couple of times for it, but I start knowing what my triggers was. I start doing my research. And I also wanted you to know, and remember I said the other day, when I do this, if you have a pen and pencil, pen and paper, write it down. When I do this, protect your heart, warning signs that you need to get checked out. So until the next time, it'll be day number 7, and we'll get into more discussion on different topics on how to protect your heart. But until then, ladies, remember I always tell you, take care of your heart until the next time.